So, hello, and you're very welcome indeed to this, our probably second, I think, podcast. And we're joined by Elaine McDermott. And Elaine is our MLD therapist here at Cancer Care West in Letterkenny. And it's very kind of her to give some time this afternoon to talk about the condition and the treatment and the clinic that she offers twice a week here at the centre. So, Elaine, thanks ever so much for joining us today. It's really gracious of you to take time out of your schedule.
Great to be on board, John. Thank you.
To join us. So, we aim to kind of keep this to about maybe 20 minutes or so. This is going to be a relatively short conversation. And it's going to be talking about MLD, its presentation, symptoms, and what we can offer here at Cancer Care West to people who are affected by this condition. So I suppose let's kick off by maybe, Elaine, can you tell us a little bit about the condition itself, and what do you think, what would you say lymphedema is? And what are the main causes that you would sort of...
Well, lymphedema is two main categories, primary lymphedema and secondary lymphedema. Secondary lymphedema is mostly what we're concerned with here, and it is secondary to something. So secondary to, say, surgery or radiation or chemotherapy.
Right.
The lymph nodes can become damaged in those cases, and also lymph nodes may have been removed as well. So it impairs the lymphatic system and compromises it.
Right. And roughly, is it? Am I correct in saying it's about 30% of patients that are affected? Is that the rough estimate?
I think the numbers. I think the surgeons will say now. I think there's, with advanced medicine and everything, it has improved a lot. We're seeing a lot less incidences of lymphedema. There's a lot more improved surgery. A lot of the surgeons are taking out less and less lymph nodes. It used to be, if it was in the lymph nodes at all, they would do full auxiliary clearance, whereas now they try to maintain as much of the lymphatic system as possible. So it wouldn't be as high as 30% now. I'd say maybe even talking about 15% now. Okay. So we should be seeing, as years go on, we should be seeing less and less incidences of lymphedema due to surgery.
Okay. And what do you think the main features of lymphedema actually are when people are diagnosed with it?
I think predominantly the first thing that people seem to report is that they feel a heaviness of the limb or heaviness of that area. It could be heaviness of the breast or the thorax, or it could be heaviness of the leg or the foot, or depending on where the lymphedema is presenting itself. A heaviness is probably the first thing that they would feel. Sometimes altered sensation and numbness and tingling, sometimes pain. And generally, for example, if it was as a result of a breast cancer, It could be just anywhere in that quadrant of the body, like in that thorax or the back or the arm or the hand. It doesn't feel the same as the other side. It just doesn't feel right.
Right.
People report that it just doesn't feel right.
Yeah, I suppose they're able to make a comparison between an affected area and a kind of a non-affected area. They're able to kind of compare sort of sensations about what it might feel like, really.
That's right.
Is that a kind of a good kind of baseline to bear in mind for?
I would say that, yeah. Okay. I would say that would be right.
Okay,
yeah.
Okay. So, what are the sort of main treatment approaches, do you think, that if someone were to kind of present with lymphedema, what were the main treatment approaches that you would use?
Okay, so firstly, I suppose we would have to see is if the patient's suitable for the treatment.
Right.
So they'd have to get consensus, maybe from their GP or their oncologist or their consultant or whatever. That's the first thing we'd have to do, is get medical consensus that they're suitable. Right. There are some contraindications, like, very common, there's a DVT with cancer patients, or cardiac heart failure, decongestive heart failure, and would probably be the main two. There are a few others, but we would need to get the okay for that. And then we would look at the patient's history, and what treatment they've had, what surgeries they've had, how long ago it was, how long after the surgery it is. And we'd be looking then at the range of movement, how much they can move, the limbs, and what sort of pain it is, and we would look then for exercise, and we'd look at the condition of the skin.
It sounds like a very comprehensive kind of...
A big assessment.
Right.
Yeah.
Okay.
There'd be a full assessment to get a full picture of what is actually happening.
Okay. Before we kind of move on to the actual sort of things like manual lymphatic drainage, as in the kind of touch therapy, can you say something about kind of the education of kind of patients, really? Do you think that education about the condition is something, to kind of worth, is education a part of your package of treatment, let's say?
Absolutely. I think education is paramount. Because when your lymphatic system has been compromised, you are at risk. It may be only a tiny risk, but you are at risk of a lymphedema. So it's imperative that you know what you can do and what you can't do, the signs and symptoms to look out for, the things, that you can do to prevent it from happening, and the signs and symptoms to look out for if you're starting to think that, there's something that's not right here.
Right.
And things like exercise and skin care and just measurements, their baseline, where they started out from, all of that. It's really important.
You mentioned skin care. Would you
Yes.
have any sort of recommendations, even generally speaking, about kind of any precautions or kind of...
Yeah, well, there's a couple of main precautions. I think the first one is skin care. We have to protect the integrity of the skin.
Right.
So if your skin is dry, then it's going to break more easily, and then it's more vulnerable then when it's more vulnerable to breaking and then to bacteria or to an infection starting.
Yeah.
And because if your lymphatic system is compromised, the immunity in that area isn't as strong as what it was. So you would have to apply an antiseptic to the area, and you'd have to know to look out for cellulitis and things like that. So if you keep the skin moisturised, it'll preserve the integrity of the skin. And the other thing then is, really to protect the skin from the sun as well. From any kind of sunburn. So anything that you can think of really that damages the skin, whether it be a bite, whether it be a bite, cut, a sting, burn, wear oven gloves, if it's your hands or your arms it's affected, wear sun cream, and to apply antiseptic straight away, and to know the signs and symptoms of a cellulitis, because you're at risk of a cellulitis as well.
Okay, I think that's really helpful for people to know, because they can presume that it's just a kind of a swelling, but really, as you say, protecting the integrity of the skin is a key deal in all of this.
It is. Yeah.
Okay. So if someone have a suspicion that they have lymphedema, and they have a conversation with their doctor, their oncologist, or any of the medics, and they're recommended to kind of come in here, you'll do that very comprehensive assessment with people. Okay.
Yes, absolutely.
Okay.
Absolutely. It's very thorough. Yeah.
That brings us, I suppose, to the actual touch therapy that you would kind of use with people. Can you tell us a little bit about what that entails?
Yeah. So it's more commonly known as manual lymphatic drainage, or MLD, people talk of it. Well, when people hear the word manual lymphatic drainage, they could sometimes get a bit of a scare and think, what is going to be drained here? Are they going to stick a needle into me and drain something out, or what is going to actually happen here? Yeah. So it's completely the opposite to that.
Right.
It's a really relaxing, soothing skin technique, more so than a massage. It's a skin technique, just very light stretching of the skin, and it's slow and rhythmic, and it balances stress hormones in the body, and as well as opening the pathways to drain any swollen areas, and it's a totally relaxing treatment.
I was just going to say, it sounds like it's quite a relaxing,
very relaxing treatment. Yeah, totally
okay.
relaxing.
So I suppose when people hear massage, that word, some people might think it's a full-on, hands-on,
Yes.
quite pressurized.
Yes.
It's not that.
No, it's skin only. We move skin only, and it's a very light skin touch.
Okay.
Very, very light touch.
Yes.
Slow, light touch.
Yes.
Yeah.
And as you say, people would probably find that very relaxing. I suppose it's kind of stands.
The word we were used in my training was called, we used to laugh at this wonderful word. It was called a sympatholytical effect.
Oh, wow. Okay. That's a nice word, that is. Yeah.
Yes.
Yeah. I suppose it stands in kind of contrast to other kinds of treatments that people would be subject to in terms of the whole cancer thing, which is...
Yeah, well, it's more clinical.
Yeah.
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 So I suppose other treatments are hallmarked by prodding and pulling, but this isn't. It's actually quite gentle, quite relaxing.
Quite gentle, quite relaxing.
Yes.
Yeah.
And tell us a little bit about kind of bandaging as well. Bandaging plays a part in the management of the condition. Is that correct?
That's right. Yeah. So after lymphatic drainage, after the treatment, depending on the condition of the limb or what is presented, the patient may have to be bandaged with multi-layer bandaging. And what the bandaging does is it further enhances the effect of the manual lymphatic drainage treatment by further pushing the fluid out of the affected area with the compression of the bandage. And the patient would maybe have to wear that for 2 or 3 days and then come back a couple of days later and have the bandages reapplied again. And they would have that's what you would call intensive treatments. And then after the bandaging phase, then we would go and look then to wear compression wear. And the reason for the compression wear is to prevent the limb from swelling again. So we apply the compression wear early in the morning to prevent the limb. People find that whenever they get up in the morning that their leg would swell as the day goes on, or their arm swells as the day goes on. Right. And what the compression garment, whether it be a stocking, sleeve, or for the leg, or other body parts there are as well. It just prevents them from filling again with fluid and helps to keep the swelling at bay, and supportive to the limb as well.
Okay, so it sounds like that's a quite important part of the whole.
And it helps with venous return as well. But I think particularly with the legs, helps to bring the blood back to the heart as well. So that's...
So in broad speak, I suppose we could say there's 3 components to the intervention. There's the education bit, which is quite key. I think that's I think we're in agreement that's a kind of a key element of managing.
Absolutely.
And then we have the actual literally the hands-on, which is not the massage that's out there. It's actually it's a very gentle, non sort of provocative.
Yeah.
And then the bandaging / kind of compression wear end of things as well. So that kind of triad, if you like, is the kind of way that it's managed. Is that the gist of? Okay,
that can be the gist of it. Yeah.
Okay. So I suppose that brings us to the question about, well, how do people would access you? How would they sort of get to be seen by you? What's the pathways in?
Yeah. Well, I suppose first of all, you can make a phone call to the centre and get an appointment, or here you can self-refer. You can be referred by your GP, or you can be referred by your oncologist or your consultant.
Okay.
Yeah.
And if people have just got a kind of a query rather than a kind of a firm, are you happy to field calls like that? Or are you happy to kind of take a call over the phone and just have a conversation with somebody about, these are their concerns?
Yeah. Yeah, we can take a phone call and but most of the time I kind of have to see the person, because you kind of have to see what it is. It's hard to build a picture of what's going on in the body without actually seeing it.
Yeah.
We can pick up some things, but usually I would need to see the person.
So coming in is
Coming in, yeah,
would be the first thing. Really.
Would be preferred.
Yeah.
But by all means, we can take a phone call and chat over it and
take it from
maybe ease their mind and answer a few questions, whatever. If there's just a couple of questions, yes.
Yeah.
No problem at all.
And as all of the services that are here, it's a completely free service. It's people don't kind of pay for this at all, so it's completely free, and that's kind of good. That's really kind of good
wonderful.
thing.
Yes,
yes, because this is an ongoing issue for lots and lots and lots of people.
Unfortunately, lymphedema is long term.
Yes,
if you develop the condition, it's long term. But to catch it early is great, and to have the education. To know what to look out for, you can prevent yourself from getting it. And even if you do, if we can get it early enough, sometimes we can reverse it. Yeah. So,
Education key.
Education is key, and early diagnosis.
Early diagnosis. Okay.
Yeah.
Okay. Both of which we can help with here.
Absolutely.
Well, I think that probably brings us to the end of our conversation. Thanks ever so much, Elaine, for sharing quite a broad and rich range of information and knowledge and expertise on that. So, as I said, thanks ever so much for taking the time to share those with us. We certainly hope that you've kind of gained some information and knowledge about the condition from today's conversation with Elaine. And please do reach out to us here if you have any kind of questions. As well as this, if you're watching this on YouTube, please subscribe to the channel. Or if you're watching via Facebook, please just give us a thumbs up or a like. So we'll leave it at that for the moment, and bye for now.